How do you tell if volleyball pain is muscle soreness or an injury? Imagine you're in the middle of a game, jumping for a spike or diving for a ball, and suddenly you feel a sharp pain or a dull ache. How do you know if it's just muscle soreness or something more serious? That's a question many volleyball players face after intense training or matches. Understanding the difference can help you avoid making injuries worse and get back on the court faster. First, think about when the pain shows up. Muscle soreness, especially delayed onset muscle soreness, usually appears about 12 to 24 hours after playing. It tends to peak between 24 and 72 hours and feels like a dull, aching sensation. It gets better with gentle movement and usually goes away within a few days. On the other hand, injury pain is often immediate or happens during the activity. It tends to be sharp, stabbing, or intense right at the moment of injury. If you feel sudden pain during a jump or land, it might be an injury. Next, consider how the pain feels and where it is. Muscle soreness feels like a general tenderness or tightness in the muscles you use during volleyball, like your quadriceps, shoulders, or lower back. It usually spreads over a larger area. Injury pain is more localized, meaning it hurts at a specific spot. It might be sharp and could come with bruising or swelling around the affected area. For example, a muscle strain or ligament sprain will cause pain exactly where the tissue is damaged. Swelling is another clue. Muscle soreness causes mild swelling because of increased blood flow, but it doesn't cause big or quick swelling. The area might feel tender but not visibly larger. Injuries, however, can cause significant swelling that might make the area look puffed up or even double in size. This is your body's way of protecting the injured tissue. Think about strength and movement. With muscle soreness, your strength might be a little reduced or muscles might feel shaky, but you can still move and perform volleyball actions. If you have an injury, you might experience sharp pain when trying to use the affected muscle or joint. Sometimes the area won't tolerate weight or stress. For example, if your ankle is sprained, it might refuse to bear weight, or a torn shoulder muscle might limit your arm movement. Range of motion is also telling. Muscle soreness usually allows you to move near normally, though it might feel stiff. An injury often limits your movement because of pain, swelling, or mechanical issues. If you notice you can't stretch or move as usual, it could be a sign of a more serious problem. Finally, look at how long the pain lasts and how it changes. Muscle soreness gets better with rest, light activity, and recovery methods like stretching or ice. Injury pain might stay the same or get worse if you keep playing or don't treat it. If pain persists beyond a few days or worsens, it's time to see a healthcare professional. In volleyball, common injuries include ankle sprains, muscle strains in the quadriceps or abdomen, shoulder overuse injuries, and tendinopathies like jumper's knee. These often happen from sudden landings, quick changes in direction, or repetitive stress. Overuse injuries develop gradually and can be mistaken for soreness but usually involve persistent pain and loss of function. To stay safe, monitor how your body responds during and after play. Sharp pain, swelling, or inability to move normally are signs to stop playing and get checked. Applying ice and compression right after an injury can help reduce swelling. If you experience typical soreness, light activity is fine, but if pain worsens or doesn't improve in a few days, see a healthcare provider. Knowing these signs helps you prevent worsening injuries and keeps your training on track.